We're measuring the electrical activity of the heart with an ECG. So first, place the patient in supine to obtain a resting ECG before the stress test. This is an example of the resting ECG that should be taken before the patient begins to exercise for a baseline comparison. After transferring to the treadmill, make sure the leads and wires are still properly attached to the patient. To perform a stress test, incrementally increase the speed and grade of the treadmill to increase exercise stress on the patient. Continue exercising until the patient's heart rate has reached a set target or until they develop symptoms that don't allow them to continue. These signs and symptoms may include moderate to severe chest pain, severe shortness of breath, abnormally high or low blood pressure, an abnormal heart rhythm, dizziness, or fatigue. A stress test is performed to assess how well the heart adapts to increasing workloads. The body requires more blood to be pumped by the heart as workload increases, so this test can be used to help determine an appropriate exercise level for a patient or if they have an underlying arrhythmia. The test may be stopped at any time if the patient is uncomfortable or does not wish to continue. With a high-quality ECG machine, you can have an ECG strip print during the stress test. However, if the machine is not high quality, you will likely see false readings of arrhythmia during exercise instead of the expected sinus tachycardia on a healthy individual. After the patient stops exercising, they may be asked to stand still for several seconds and then lie down for a period of time with the leads in place. The medical professional can watch for any abnormalities as heart rate and breathing return to normal. Take an ECG after the exercise test in order to determine changes from rest to post-exercise. If leads have fallen off, make sure to reattach them before performing the post-test ECG reading. Finally, be sure to explain the results to your patient. If there are no concerning findings, the patient can return to normal activities. As physical therapists, we typically look at lead 2 of an ECG. This is a 12-lead ECG, which means that the strip is 10 seconds long. To get a quick estimate of heart rate, count the QRS intervals highlighted by the red circle on a 10-second strip and multiply by 6. This rhythm strip has 13 QRS complexes, which tells us that the heart rate is about 78 beats per minute. All the QRS complexes are evenly spaced apart, indicating normal sinus rhythm. The QRS interval should be less than 100 milliseconds, and this ECG reports her QRS interval to be about 78 milliseconds. This is the time of ventricular depolarization and atrial repolarization. Next, we want to look at the PR interval highlighted by the green circle, which should be between 120 to 200 milliseconds. Each little box of an ECG is equal to 40 milliseconds, so you can count the boxes between P and R to obtain this measurement. But as you can see on this strip, the PR interval is also reported as 144 milliseconds, which falls within the normal range. The PR interval measures the time from the start of atrial depolarization to the start of ventricular depolarization. The T wave, highlighted in blue, represents ventricular repolarization. The mean electrical axis should fall between 0 to 90 degrees, which is the general direction of electrical activity in the heart, also known as the wave of depolarization. The impulse moves from the SA node to the AV node to the bundle of His, then the bundle branches, and finally to the Purkinje fibers. The normal response to an exercise stress test is sinus tachycardia, as shown here. As you can see, there are 25 QRS complexes, and using our algorithm to calculate heart rate, we would estimate 150 beats per minute, which is close to the actual heart rate of 154 beats per minute. The QRS complexes are still evenly spaced apart, so aside from the expected sinus tachycardia, there are no observed cardiac arrhythmias.